Glaucoma is a genetic condition, and it usually is a condition of high eye pressure. This pressure within the eye is too great and to allow good circulation, blood flow, and just overall health of the optic nerve. So the optic nerve in the back of the eye that connects your eye to the brain can slowly sort of wither and die under that pressure. What that translates to is a loss of vision that typically starts in the periphery, out in the far peripheral vision that patients may or may not notice at first until maybe it's advanced. If they're not being seen, checked, or treated for glaucoma, it can progress all the way to the center of your vision and take your vision completely if not treated or detected early enough. So when we detect glaucoma, it's usually found by a high pressure or a finding on exam that shows a thinned out optic nerve. Although it is possible to have progressive optic nerve loss or thinning with normal pressure, and we call that normal tension glaucoma. So whether it's high or just too high for your eye, the target or the aim of treatment is to lower intraocular pressure so the nerve stops its slow death and slow vision loss.
Patients can come to cataract surgery with glaucoma. It is a completely separate disease process inside of the eye. And at the time of cataract surgery, we have procedures that can benefit glaucoma. Mainly, it's ECP. And ECP stands for endoscopic cyclophotocoagulation. Now that's a mouthful, which is why we say ECP. So what is ECP? It's a procedure that's done typically at the time of cataract surgery. And it's done through the exact same incision that we're making for cataract surgery. It just takes a few extra minutes, and we are treating the portion of the eye inside of our eye that creates fluid. So what determines eye pressure? Eye pressure is determined by there's a portion of the inside of our eye that creates fluid, and there's another portion inside of our eye that drains fluid. And it's the balance between the faucet and the drain that determines eye pressure. ECP is a laser that treats the faucet, and it turns down the faucet permanently. And multiple studies have shown that ECP is equivalent in the average patient to 1 glaucoma medication. So what that means for a patient that is going to have cataract surgery, if they have ECP and they're on a glaucoma medication, they're most likely to get off of it, which is a huge benefit for patients. You have less expense, you have less hassle, you have less toxicity of that medication over years and years of using it on the surface of the eye. There are big benefits to getting people off of medication. ECP is not a cure for glaucoma. There is no cure. Patients still have glaucoma even if their pressure is under control, which means you need to be followed and you need to be sure that you don't lose optic nerve function going forward.
Whether ECP is done as a standalone procedure or at the time of cataract surgery, the healing time is fairly rapid. Patients will notice a little bit of blurred vision, maybe redness of the eye, light sensitivity, and will typically be on drops for about a month, an antibiotic for a week and a steroid for a month to control inflammation. But typically they are feeling almost back to normal within a week. Anybody with high intraocular pressure, which can be called ocular hypertension, or damage from this high pressure, which is what glaucoma is a good candidate for ECP. There are instances where glaucoma is very severe and there's a tremendous amount of nerve loss that the mild to modest reduction in pressure that ECP offers may not be enough. And those are the instances where I will refer those patients to a glaucoma-specific surgeon who treats glaucoma all day, and that's all they focus on, to perform a more involved and invasive surgery to lower intraocular pressure, with the target for those patients usually being single-digit pressure readings.
So the goal with ECP is to reduce the medicated eye drops for controlling glaucoma. And so not 100% of patients respond the same way. I've had patients get off of 2 medicated eye drops with ECP. I have had patients that had to stay on their eye drops for glaucoma after ECP. So I think of ECP as just one more modality to help to control eye pressure.